doctor of optometry. My primary duties here is I see pre- and post-op surgeries. I work under Dr. Martin, so emergency care. I take care of the cataract patients, the LASIK patients. I see them after surgery, and pterygium surgeries, which is of the cornea. It's a growth that grows over the eye. I see all those patients. I'm presently going to start seeing my own patients as of next month. I'm midway through 2014. I'm an optometrist, and I do refractions, eyeglass prescriptions, contact lens prescriptions, and then we send them out to another practice where they can fill the prescriptions. I first started when I was younger. I went to hotel management school. I thought I would run a hotel, and I got a major in hotel management, a minor in culinary, so I was in that field for a long time. I worked in Manhattan running businesses. And shortly after that, I wasn't fulfilled with that program. I was more stimulated to learn more. So I started studying, and I took a course in Stony Brook University in psychology. So I started school in the early 80s rather. And I went back to school at Stony Brook University, pre-med for psychiatry. And shortly after that, I met somebody who detoured me into optometry. And once I got into optometry, I really liked the field. And I pursued it from there. So I graduated from Stony Brook with a Bachelor of Science with some pre-med courses in psychology. And shortly after that, I went to Inter-American University School of Optometry in Puerto Rico. I worked in another ophthalmology practice right after graduation for like 8 years. And I started here about 8 months ago. I'm also an AOA member, American Optometric Association member. Actually, some patients after surgery, they're a little at unease, and my job is to make sure that process, during post-op period is really relaxed for them. I don't want them to be stressed, and most patients do very well after surgery, but some patients, they get a little anxious, going into a surgery, and then thereafter it's usually pretty easy, unless just coasting them along. That would be the most challenging, making sure their visions, everything's okay, they have the right medicines. You take a cataract patient, they go, we're not seeing well at all, and the most satisfying thing I feel is after surgery, watching them progress and with their new vision, and watch the end results after the post-op period is done. And they do very well, and they make sure they have, they smile through the way, make it as easy as possible, and actually get close with my patients and make that transition from poor vision to good vision go very well for them. But I like sports, play a little bit of sports, like my leisure time in the yard, family oriented, and traveling is my things I like to do on my own time, which I haven't get to lately, is travel. I would like patients to know about me is that I have a very caring doctor. Once again, when you see them post-operatively, it's really imperative that you have somebody in that seat looking at the patient, making them feel comfortable, touching base with them personally, and making sure that transition goes well. I never speak at a patient, I only speak to a patient. I have seen doctors where, they walk out of the room where there's, as the patient's talking to them. So I make sure I actually speak to my patient, I laugh with them. I give them my card. I make sure you contact me anytime, during this period. If they can't get me, they can contact my technician or Dr. Martin or the other ophthalmologists that work here. I'm bilingual. I speak Spanish. I'm Italian descent, but like I said, I went to school in Puerto Rico. I learned a lot of Spanish, so it helps assist patients with the Hispanic background.